All right. Welcome, everyone. My name is Victor Mercadante, and I'm a assistant professor here at Virginia Tech. I'm also a member of the Beef Reproduction Task Force. And I want to just give a couple remarks, some housekeeping things. We are broadcasting live on Facebook, and we are also going to be recording these webinars, and they're going to be available later on our YouTube channel and our website, beefrepro.org. And throughout the webinar, if you have any questions, I would encourage you to type them on the Q&A tab of Zoom, and we will address those questions towards the end of the webinar. But please do not use the chat box, rather use the Q&A tab. But I also want to remind everyone this is going to be a monthly webinar from the Beef Reproduction Task Force. We're going to be doing this every third Wednesday of the month. So, and to kick us off, we have Dr. Kai Pohler from Texas A&M Department of Animal Science. And Dr. Pohler is also a member of the Beef Reproduction Task Force. And we're happy to have him kick off this series. So, Dr. Pohler.
All right, Vitor, thanks a lot for that introduction. And can you hear me okay, first of all?
Yes, we're good to go.
All right, excellent. Okay, well, it's a pleasure to be here with you tonight, visiting with you a little bit from the Beef Reproductive Task Force. And like Vitor mentioned, we're really excited to kick off this series of webinars that are going to be monthly, and I'll talk about that here in just a slide or two. The real goal of my talk tonight is to really focus on some realistic expectations for pregnancy rates in our beef herds, and I'm going to give some introductory material about the task force, and then we'll switch over to this topic. So I think one of the things that I just want to point out tonight, a lot of people that are maybe joining this or have been following us on Facebook or whatever, the Beef Reproductive Task Force is a group of academicians, folks that have research and extension appointments that are really focused on promoting the wider adoption of reproductive technologies among cow-calf producers. And our goal is to really educate cow-calf producers on how to implement technology, to evaluate technology, and sort of put on exercises throughout the year, and mainly being with our Applied Reproductive Strategies meeting every year that we've held annually. This year we held it virtually, to really increase the likelihood of success to AI breeding and really all reproductive technologies in general. And, you know, if you look at the current members of the Beef Reproductive Task Force, made up of folks from all across the U.S. In different universities, we have veterinarians, we have extension specialists in genetics, we have extension specialists in reproductive physiology, have researchers like myself that focus in reproductive physiology and biology, but really a group of people that, you know, bring together a lot of different expertise to sort of evaluate technology and put on producer-based exercises and learning opportunities throughout the year. One of the big things that I encourage you to do, we've recently done a facelift to all of our pages, and so I encourage you to visit the beefreproductive.org website. A lot of information there. You can find links to all these webinars that are going to be held at the third Wednesday of every month. And this is the first one tonight. Follow us on Facebook. There's a Ask the Expert tab at our website. Feel free to email us there with questions, and then also on Twitter. You can also access all the webinars that we had as part of our recently held virtual Applied Reproductive Strategies meeting at beefrepro.org, or access our YouTube channel there, and that's where all the videos are being housed. So a lot of great information there. Of course, we're going to try to cover this, some of these topics and some of this information as we go throughout the year, but I encourage you to go back and look at some of the old material that's been covered that is still relevant to what we're working on today. The other thing that I would encourage you to do is, if there's a topic that we're not really hitting on in any of these webinars that you would like to hear some more about, please send us a note at the info at beefrepro.org, and hopefully we can organize something to make that happen. I think one of the big things that the task force is really proud of, that we work on every year, is to evaluate synchronization protocols that we recommend for beef producers. And these are the 2 protocol sheets for conventional semen protocols that we just approved back in November, on November 17th, for conventional semen, so the use of conventional semen. And these protocols are broken down by beef cow protocols. We have heat detection in time AI. We have fixed time AI for Bos taurus cows, and we have fixed time AI for Bos indicus cows. And essentially, we have the same thing on the beef heifer protocols. And as we look at adding and removing protocols from this sheet, a lot of these protocols have thousands of inseminations, thousands of data points with pregnancy rates. And so these protocols we feel like are currently the best protocols that are out there, that have the most reliable data across multiple environments, multiple types of cows and estrus, cows that are cycling, and really have been proven over and over again to be successful. One of the things that we're really proud of this year that we were able to put together and was recently approved is the sex semen protocol sheet. And so this sheet you can now find on our website, and we'll potentially find in semen catalogs that are coming out to print later this year, where we have recommended sex semen protocols. And one of the things that we feel like is that as sex semen continues to increase, the technology continues to get better and better, is that we really need to focus on some protocols that worked well in this. And so this is the first year that we're putting this out. And so again, if you have any questions on this, please let us know. But one of the things that I want to point out is when you look at all these different protocols, so we have now 3 sheets of protocols. You might ask yourself, what protocol is best for me? What protocol is best for my operation? And the thing that I encourage you to think about and to utilize is work with the AI companies that you might be purchasing semen from, visit with the extension staff in your state, or email us at info@beefrepro.org and ask those type of questions. The thing that I also want to point out is that as you look at the fertility coming off all these different protocols in these different sections, the fertility across multiple locations, across different types of cattle, is most likely going to be pretty similar. And as we evaluate these types of data, one of the things is that there's a lot of variation that goes into the field fertility data that we get in and look at. And so what I want to go through tonight and talk to you a little bit about is what are some realistic expectations? What are some realistic outcomes? And I think a lot of times we get caught up thinking about what's the highest possible pregnancy rate that we can obtain from a synchronization protocol. And, I think about it, I was just transferring embryos on Monday and Tuesday of this week. And sure, when I think about what the pregnancy rate I would like to obtain, I would like to get 75, 80% pregnancy rate. But is that a realistic expectation? Most likely not. And so the goal tonight is I want to take you through and talk a little bit about what happens in early pregnancy from a very high level, and then talk about a large systematic review that we've recently conducted in regards to what are realistic expectations out in the field for pregnancy rates to some of these different protocols and some of these different technologies, such as AI with heat checking or estrus detection, time AI protocols, and then embryo transfer. So I'll start with this. Why and where does pregnancy loss happen? So if we start with early pregnancy, we obviously have a female oocyte that has recently been ovulated, that has undergone fertilization or is in the process of undergoing fertilization. And this is happening in a part of the uterus called the oviduct. Now, as that embryo starts to develop, that embryo will migrate from this location in the oviduct down into the uterus itself. And during that point, the embryo is in a spherical shape, okay? So it's in the shape of a sphere, and will migrate into the uterus, at which point it will start to grow and undergo embryo elongation, all right? So embryo elongation, where the embryo goes from a sphere to a elongated embryo, is happening around day 15 to 17 of gestation. This is also the same time that the embryo is needing to signal to the cow or to the maternal environment that the embryo is present. Okay, this is critical for what we can call maternal recognition of pregnancy. And this is a critical step in order to maintain pregnancy. From that point forward, the embryo continues to grow, from this 18 to 27-day period, at which point it starts to attach to the uterus and starts to set up solid connections to the uterus, all the way up to about day 45 of gestation, where you have a really firm attachment and a really firm connection to the uterus, and you have the formation of placentomes between the maternal and fetal side of the pregnancy. Now, you can see here on this slide that I've used this slide before and show that we estimate about 95% of the time fertilization happens accurately or happens and is successful. And then at day 27 of gestation, we have about a 70% pregnancy rate. And I show you this because this is an estimate that we use for a long time. And I used to have another slide that had all these different bar graphs associated with it that we used to use based on old data that has been summarized in what we'll call sort of a non-systematic way. And so one of the things that we wanted to do is really review all the data available in the literature that my colleagues have published around the world, that have been published in extension articles, that have been published in any format that has undergone the peer review process, and that we could actually get access to the data. And so the way we did this was we used available data to use a systematic review to obtain an accurate prediction of what embryonic failure or pregnancy rate, depending on how you look at it, during multiple periods of pregnancy development in beef cattle. And this has recently been done on the dairy side, so we really wanted to update the numbers on the beef side, and that's exactly what we tried to do. Now, a lot of people have asked me what has gone into these data sets, what are things that we included and what are things that we excluded. So what I mean by this is, as we looked at data sets to include in this large review, the one that I'm going to show you the data out of, what allowed cows to be used or heifers to be used in the data set and what got them eliminated, all right? And I think this is important because you have to clean up the data a little bit. You have to understand when the cows are undergoing pregnancy diagnosis, et cetera. You can't just randomly take in field data and sort of interpret it all the same way. So we had some criteria set in place. So the inclusion data, they had to be cows or heifers that were predominantly beef breeds. Okay, so this is looking at pregnancy rates in beef, so we wanted only beef breeds. It had to be published after 1978. And the reason that this is really important, and we really didn't use any data that came from earlier than the mid-1980s, is because a lot of the periods that we set for pregnancy diagnosis, we wanted accurate pregnancy diagnosis, so we utilized a lot of ultrasound data, and so that excluded some of those papers. It had to include days of gestation of pregnancy diagnosis, so we had to know what day they did the pregnancy diagnosis. For example, was it done on day 28? Was it done on day 35? Was it done on whatever? We have to know the subspecies of the cattle, so was it Bos indicus or Bos taurus? This is a really big, what we're going to call a moderator, a really big effect in the data set. We had to know the location. I will tell you, we included locations from the United States, locations from Brazil, locations from Russia, Canada, Europe, South Africa. So a lot of data went into this. We had to know the parity of the animals. We had to know what type of breeding method was used, AI with heat detection, timed AI, or embryo transfer. Exclusion data. So what got the data kicked out? If there was any type of induced twinning, a lot of papers from the late 80s, early 90s had a lot of induced twinning, so that was kicked out. Study treatments that were detrimental to pregnancy. If there was a study being done that was thought to have a negative impact on pregnancy rates, that data was excluded because we were trying to evaluate what are the overall averages of fertility based on these synchronization protocols out in the field. First pregnancy diagnosis was somewhere but after day 32 of gestation. If you look at, we wanted a solid day for the first pregnancy diagnosis. And the reason that this is so important to us is because we know that there's a lot of pregnancy loss that happens between day 33 and about day 40 of gestation. So we really narrowed this window to get a first pregnancy check between day 28 and 32 of gestation. And of course, any animals that had any dairy genetics or Holstein or other dairy breed origin were eliminated. So that's sort of the criteria that we used to include data into the overall study. Moderators. So what were major factors that showed up in the data as having an effect? Okay, so the parity of the animal had a large effect. I'm going to show you that. So nulliparous, multiparous, primiparous animals, and then the subspecies, Bos taurus versus Bos indicus. Okay, so the way we characterize these is a nulliparous animal, a virgin heifer, was a heifer that never had a calf before. A primiparous animal is an animal that had at least or had one calf, and a multiparous animal is a cow that at least had two calves. Okay, and so this we had to have this data reported in order to truly interpret what the results meant. We also had to have subspecies, like I mentioned. So I'm located in Texas, where obviously there's a lot of Bos indicus breeds and a lot of crossbreeding between Bos indicus and Bos taurus, and really wanted to evaluate this. So we really needed to know whether the animals were Bos taurus origin or Bos indicus origin. Now, how do we characterize this? In order for an animal to fall into the Bos indicus category, she had to have at least 50% Bos indicus genetics. All right, so the rest of those animals went into the Bos taurus category. And obviously, if so, like this animal, this Nelore cow would have gone into the Bos indicus, and this Red Angus would have gone into the Bos taurus. The other thing that you'll see here in just a second is another major moderator that I'll show you is the breeding technique. So AI, again, with heat detection, time AI, or embryo transfer. So these are the periods of gestation that we looked at. So what we call this type of analysis is a meta-based analysis. Basically, that's a fancy way to say that we just did a large review of the literature that's out there. So the way we broke it down is we characterized papers in fertilization and early blastocyst development as happening between day 3 and day 7. And I'm going to show you the data behind this. Now, this area has the least amount of data in the overall data set that I'm going to show you. And the reason for that is because in order to figure out whether an animal has undergone proper fertilization or not, is you have to slaughter the animal and harvest the reproductive tract. If we think about how not how flawed the technique is, but how difficult it is to get every embryo out of a cow's uterus with something like embryo transfer, where we do conventional flushing, that's the reason that we only utilize data where the animal was sacrificed, the reproductive tract was harvested, and basically you had it flushed out on a table to make sure that we really understood the pregnancy loss in this area. So that's the first time point. And then we move into this early embryonic mortality period from day 8 to day 32 of gestation. And if you think about this early embryonic development period, this pregnancy loss is really the pregnancy loss that ends up in the cows recycling back in a breeding season, getting bred back by the bull, and we really never see this show up. Okay, obviously we see it show up in decreased pregnancy rates to AI or time AI, etc. But it's not something that probably we are following these animals and seeing this happen before our eyes. Now, as we move out from this next period, where we go into the late embryonic mortality and early fetal loss, which is this time period from about day 28 through day 100 of gestation. This includes late embryo development and early fetal development. So we were interested in characterizing the pregnancy loss that happens really after that first pregnancy diagnosis. And I'm going to show you potentially some of the financial, the economics behind this type of pregnancy loss. And so these cows, I would tell you, are those cows that we confirm pregnant in a breeding season at a first pregnancy diagnosis, but end up losing that pregnancy. Sometimes they never get bred back in the same breeding season, and sometimes they get bred back and they're just one of those late breeders. So these are really the windows that we were interested in looking at: early embryonic development or early embryo mortality and late embryo mortality. So this early embryo mortality would give us a pregnancy rate, at that first pregnancy diagnosis, and then this late embryo mortality would give us a pregnancy rate after day 100 of gestation. And that's really the way that I'm going to break it down for you. So the way that I'll set these next few slides up is, the first I'm going to show you it from an embryo mortality point of view. Okay, and so that's the sort of the negative way to look at it. And then I'm going to show you the pregnancy rates that can be expected. And all I'm doing is I'm taking 100%, subtracting out the embryo mortality, and that's giving us the pregnancy rate. Okay, so what's the data sets that went into the early embryonic mortality? So we had over 50,000 diagnostic records that included the data that I mentioned earlier for inclusion into this data set. And so the overall point estimate, or the overall average pregnancy loss in the first 32 days in the beef herds that we evaluated, was 47.9%. Okay, now where did those break out in these different categories? As we go through these different categories and start to look at this, parity was something that was a significant moderator, which means that it was significant in the data sets. We all probably knew this already, but these are what the realistic numbers are. So these virgin heifers, or these nulliparous heifers, their average pregnancy loss in the first 30 days was somewhere around 46% or 45%. So if you follow these numbers down, that point is the average, so 45%, and then you have a confidence interval around here. There was 49 sets of animals that went in here. That's not 49 heifers, there's 49 sets of data, okay? Total, all the sets of data together equaled over 50,000 animals, okay? So that's where the 50,000 number comes from. Primiparous cows, so these are cows that have had their first calf and are breeding back in that breeding season. Their average pregnancy loss in the first 30 days was 55%. Multiparous cows, somewhere a little bit higher than heifers, between 45 and 50. Now, subspecies. Bos indicus influenced animals had a higher early embryonic mortality compared to Bos taurus influenced animals. Now, I caution you in the interpretation of this. I personally don't think that Bos indicus animals have decreased fertility to Bos taurus. I think that the climates and the environments that we've put them in are where we're seeing this sacrifice in fertility here in early gestation in those animals. As we go down to breeding method, we had 13 data sets that included AI with heat detection. We had 83 data sets that included fixed time AI, and we have 10 data sets that included ET data. The pregnancy loss from the AI with heat detection was somewhere between 30 and 35%. Pregnancy loss or early embryonic mortality to the fixed time AI was right around 50%. It's really close to that overall point estimate. And then as we got into ET, you can see that was a little bit higher in the 55% range. There was no other significant factors in the overall data set, which means that protocol was not significant in regards to having an effect on the overall pregnancy rate from these herds. So let's flip this over and look at pregnancy rates. So what's a realistic expectation for pregnancy rates at a day 28 to 32 pregnancy diagnosis when I look at any of these different types of scenarios? So if I go into a group of animals that are either Bos indicus or Bos taurus in origin that have undergone a fixed time artificial insemination, my expectation for pregnancy rates in the first 30 days on those Bos indicus animals is somewhere around 50%. That's what the average was in these data sets. If I look at Bos taurus, it's somewhere around 56% on average. If I break it down and start to look at these different techniques, you can see the difference there in pregnancy rates and the same thing in parities. Now, I'm showing you this because this is what the averages are across the data sets that we had access to, that we had data that we knew where it came from and you know, had all the different parts and pieces to make this happen. Animals weren't eliminated, whether they were cycling or not cycling. It includes all the animals here to look at this. So let's look at where these animals are failing in pregnancy in these first 30 days. So like I told you, the first thing that we looked at was the first 8 days of gestation. Each one of these dots represents a study where animals were slaughtered, looking at the number of viable embryos that were recovered, which was equivalent to a pregnancy rate in the first 8 days of gestation. And what we came up with is that at day 7, the point estimate is for an overall pregnancy rate of 71 to 72%. Now, I really caution the interpretation of this again because there's not a lot of data and not a lot of studies done in this specific area, all right? So it's really hard to know if this is an accurate measure of pregnancy loss or pregnancy rate in the first 7 to 8 days or not, but this is what the data we have today is telling us and kind of what we're using to estimate when and how losses are happening. As we go from day 8 to day 18 of gestation, this is another window of loss that a lot of people have studied, a lot of people have looked at. What are some of the mechanisms of pregnancy loss during this period? And one of the things that was quite interesting that has been now really repeatable in a lot of different data sets, including this one, is from day 7 to day 16 of gestation, there seems to be very little pregnancy loss. And so if you think about it in an embryo transfer situation where we transfer embryos on day 7 or day 8 of gestation, and we think about when they might be losing a pregnancy, they're probably not undergoing a lot of pregnancy loss between day 7 and day 16. And there's some data sets that support this. This is a data set that came out of University of Missouri, out of Tom Spencer's group, where they used embryo transfer to generate a series of animals that had high fertility, where they conceived to pregnancies from embryo transfer multiple times in a row. You had subfertility animals that did not achieve that, but were able to at least achieve one pregnancy. And then you had infertile animals that got pregnant 0 or 1 time from 4 embryo transfers. And what I want to show you is that there's really no difference in the pregnancy rate at day 17 between the high fertility and subfertility animals. And so kind of what that tells me, and I think us as a group, is that there's a lot of pregnancy loss happening in the first 7 days of gestation, and then there seems to be a lot of pregnancy loss happening after day 17 of gestation. We've also seen this in our data sets where we've done a lot looking at pregnancy loss between day 24 and 31 of gestation. I'm not going to go through all this, but I just want to point out, I think we all take for granted how fast things can change in pregnancy. And as we think about, working our animals, keeping our animals up, bringing them up for pregnancy diagnosis, this is a set of data and multiple sets of data now. There's 3 publications here that have really surprised me in regards to pregnancy loss. We looked at pregnancy loss from 24 to 31 in 3 different sets of animals, where we had lactating dairy cows, we had dairy heifers, and we had beef heifers and beef cows. And essentially, as you go through here, in the lactating dairy cow, we had about 20% pregnancy loss from day 24 to 31, dairy heifers 11%, and our beef heifers and cows somewhere around 5 to 6%. And if you think about that, even in our beef animals, that's about a percentage a day for 7 days as we're leading up to that pregnancy diagnosis, as we get close to determining doing that first preg check. So just showing this to give you an idea of maybe when that loss might be occurring. As we move over and get into this next phase of pregnancy loss, this late embryonic early fetal mortality. So this is from day 32 to day 100 of gestation. Pregnancy diagnosis was done either at 60 and 100 of gestation. Overall point estimate somewhere around 6%. And we had about 30,000 diagnostic records that went into here. Again, broken down the same way. These are the effects that I'm showing you. I show you the Boston-Nicus bostaris because it was significant in the early. It doesn't seem to be any major effect in the late embryonic mortality side. So they're running about the same, about 5 to 6%. Now, parity. Primiparous and multiparous cows were running about 5 to 6% in regards to pregnancy loss between the first preg check and the second preg check. Now, one thing that we've seen over and over again in large data sets is that our virgin heifers, our nulliparous heifers, are having higher pregnancy loss after the first pregnancy diagnosis, so between this day 30 and 100 range, than any other parity. And this is very repeatable and something that I think we need to pay attention to in our heifer populations that we're working with. The other thing is breeding method, fixed time AI, and embryo transfer were significantly different in the amount of pregnancy loss. Anybody that's been working in embryo transfer will know that this is true. We see a lot of late embryonic early fetal mortality in embryo transfer, somewhere around 10 to 15% in this data set. Fixed time AI, somewhere around 5%. So the question really boils down, what is a realistic expectation for pregnancy rate at day 100 of gestation in these data sets and these cattle that we're looking at? So day 100 of pregnancy, we have pregnancy rates projected. Okay, so I took the data. This is using those different periods now.
Sorry, it looks like my Vitor, can you still hear me okay?
Yeah, we hear you, Kai.
Okay, I lost, my microphone seems to have cut out. So as we go through this, you can see the day 100 pregnancy rates as we move forward. So as we look at Bos indicus, Bos taurus, at day 100 of gestation, average pregnancy rates across these data sets was 50 and 44% pregnant to that original pregnancy diagnosis. As we look at the 47 or the day 100 across these different parities, you can see nulliparous 47, primiparous 40%, multiparous 46.9%. As we move forward to the fixed time AI and embryo transfer, average pregnancy rates at day 100 for fixed time AI 45% and 35% for embryo transfer. So again, as you think about this, I think these pregnancy rates are slightly on the low end of what my expectations were when we started to look at this data. But I will tell you, these are what the published literature is showing us on what's out there and what we are seeing in the herds that we're working with sort of from a research point of view in regards to sort of controlled environments and taking all the variables into account to kind of see what's happening. And if you're interested in reading more about this, this is all published under that publication. So why does it matter? Why do we really care about pregnancy loss? If you look at these different scenarios, so we have animals that are bred to time AI, which is sort of the baseline animals. Okay, they're bred to time AI. They're going to calve early in the calving season. We have these embryos that are these cows that undergo early embryonic mortality. They're in that first 32 days. I showed you those. So you breed them, they originally get pregnant, they lose a pregnancy in the first 30 days, they rebreed back, and their calf is at least 21 days delayed in the calving season. You have these late embryo loss cows, they get bred in the breeding season, they lose a pregnancy after the first pregnancy diagnosis, but they get pregnant again in that breeding season. Their calves are on average at least 60 days later or younger than the calves that were bred to the time AI. And then, of course, we have the cows that never calve, and they never calve because they either never got bred or they lost that pregnancy. If we look at weaning weight and just take an age by 2 pounds per day gain, you can see those different pounds per day across there. You can see how the early and late embryo loss affects that. And then obviously if they never calve. And you can see if you plug some market value in, obviously that's a market value that's quite high right now. But if we plug in some market value, you can start to estimate what pregnancy loss and embryonic mortality is costing your herd. And so I encourage you to kind of think about this, think about as you set your realistic expectations for pregnancy rates on how that comes into play. And the reason that it really matters is they all cost the same to maintain. Until we can figure out how to separate animals based on, if we know the cow is going to lose a pregnancy late or early, we're going to cull her off, sell her. A lot of this we're retrospectively determining at the end of the breeding season or at the end of the calving season to determine this. So they've gone that entire time with us thinking that they're pregnant, and yet they have no return in our investment, and our investment has been equal across all those different animals. So what controls pregnancy loss? There's a lot of different factors that go into controlling what pregnancy loss is. And obviously the two biggest factors that come into my mind are sort of the male side, the bull side, and the female side. And I will tell you, traditionally, we have thought of how the male has a very large effect early in gestation. Obviously, the sperm need to swim up the reproductive tract, or if we're talking about a natural mating situation, the bull needs to mount the cow, breed the cow, etc. And then as pregnancy moves forward, the contribution to pregnancy loss or even pregnancy development comes at a higher point to the female. And whether that is true or not, there seems to be data suggesting that it's actually not true. That's sort of been the classical school of thought. And so I just encourage you to always think about whether it's the male or the female that's driving your pregnancy loss or your fertility issues that you might be having in your herd and how to deal with those. A lot of times when we think about poor fertility, we think about a cow showing up for a pregnancy diagnosis and being open or not pregnant, and she's suffering the consequences by being sold or being pulled from the herd, where it could potentially be the male's fault or the bull's fault that she ends up actually open. So I'm just going to give you one idea on the female side and then one idea on the male side, and then we'll take some questions on what drives pregnancy loss. Obviously, nutrition, genetic, and hormonal factors all come into play when we think about fertility and pregnancy loss. I'm just going to show one in regards to estrus detection and the effect of estrus in a time AI protocol. So time AI protocols are when we breed animals at a given time on a given day. We breed all the animals. One thing that we do in our projects is we put on these estrus detection patches. For whatever reason, my mouse has quit working, but you can see them listed here, where essentially we score these patches when the cows come in for a time AI, and they get a score of 1 to 4 depending on how much they've been rubbed off based on the amount of estrus activity that they've had. As we look at pregnancy rates compared to these, you can see as the amount of patch rubs increase or the amount of estrus activity increases, even in a time AI protocol, the increase in fertility is there. All right. And so, something simple to do that we're recommending in our sex semen protocols is to use estrus detection, use an estrus detection aid. You don't have to detect estrus, right? When you bring the cows in for the time AI, breed the cows that have come into estrus with sex semen, and use conventional semen or delay insemination on the cows that have not shown estrus. Just a simple idea to increase fertility. One other thing that I think we a lot of times forget about that we have to pay closer attention to over time is what's the male's factor and male effect in all of this. This is a set of data that is just observational data. Okay, so there's no statistics applied to this. So this is all field data. All right, so I just want to show a simple point of this. This is field data that we've been able to gain access to from Brazil that has all Angus matings in it. Okay, Angus Nelore matings. So they're all Angus bulls, where we have different AI centers, so different collection facilities. And we have number of artificial inseminations here in the next column. And then we have pregnancy per time AI. And you'll see the average pregnancy per time AI is in line with those 50% that I was showing you earlier in those realistic expectations. And then this is pregnancy per time AI by different sires. And what I want to point out is look at the massive amount of variation that we're seeing from these different bulls. Okay, so if we go to collection facility E, there's a bull that has a pregnancy rate of 28%, and there's a bull that has a pregnancy rate at 72%. And my point with showing this is the average is 54%. If we want to increase the average, one way to increase the average is to get rid of the subfertility or poor fertility bulls. And in this case, that 28.2% fertility bull may be really dragging down that average. So that's just one thing to think about and consider in regards to that. The other thing is that as we think about bull fertility, this is a slide that came from one of my friends, Matt Utt, where you look at sort of the introduction of uncertainty in fertility. And what Matt has put together is you have semen quality on the top. So you have all these independent variables of the bull, you have the different straws that they're put into, you have the different batches, you have the different semen handling. But then we get into the environment. We have different cows, different management systems, and the farther you get away from the bull and the farther you get out into the field, the more that level of uncertainty opens up. And so it's just a reminder, and I know we'll have talks about this and webinars about this, to have good semen handling and the best techniques, to utilize the best techniques as you sort of work out in the field. So take home points. Have realistic expectations, set realistic goals. I think that it's good to have lofty goals. I think we should always strive to increase fertility of our cow herds, but we have to be realistic in how we set those expectations. Remember, reproductive management is only one part of a beef operation. You have nutrition, vaccination, animal handling, everything else that goes into it. And so working in a university, we obviously hear people say all the time, well, I just want to achieve 70%. I just want to make a 70 on that test. I just want to make a 70 in your class. And the reality is if you make a 70% in each of those four areas, nutrition, vaccination, animal handling and stress, and reproduction, you have to multiply those 70% by each other, which brings you to a 24% in the overall success of where you are from a management point of view. And the last point that I'll leave you with, if you look at that just in regards to reproductive management, And I think about synchronization protocol compliance, giving the right injections at the right times, cows keeping their CEDARs in, etc. Thinking about body condition score of my cows, having my cows an optimal body condition score, having the highest fertility semen possible, making sure my technician knows what they're doing. Even when I have 90% in each one of those areas, the expected results are somewhere around 65%. If I decrease one of those to 70%, you can see in the next line, I drop my expected results to 51%. So details really matter from a reproductive management point of view. And I can't tell you how many times, even in our own system here at the university where we have animals that maybe aren't in the optimal body condition score. And you can't overcome that with whatever protocol you use. If you have good body condition score, you have good semen quality, you have good technicians, and you use the appropriate synchronization protocol, that's when you have the highest chance to be successful. So with that, I appreciate everybody that has sponsored us. I appreciate everybody that has joined us tonight. And I will take any questions. And sorry, my mouse has quit working, so my pointer is just stuck there in the middle. But again, appreciate everybody joining us for these webinars and look forward to them moving forward over the next few months.
Excellent, Kai. Thank you very much. Just want to remind everyone that please type your questions on the Q&A tab. And Kai, can you see the Q&A?
I can't open it, Vitor. I can't move my mouse.
Okay. All right, I'll read it for you. There was the first question was, if you can define pregnancy rate. There was a question whether you're doing risk of pregnancy or on that meta-analysis. What exactly were you referring to?
Yeah, so pregnancy rate is referring to the total number of animals and in that situation, the total number of animals that were inseminated. So basically, if there was 100 animals, they were all inseminated in a time AI. So that pregnancy rate is the total number of animals that got pregnant out of all those that were inseminated for that time AI.
Our second question, when would you suggest doing the first preg check? So like, what's the best time to do preg check so that you are making sure you're catching that early embryonic losses?
Yeah, that's a really good question. So I think that if you want, so it comes down to if you want to catch animals that are undergoing early pregnancy loss and finding those animals that are also undergoing late embryonic mortality, you need to do a pregnancy diagnosis between 28 and 33 days. And you have to break this down. If you're going to do a pregnancy diagnosis just for the sake of doing a pregnancy diagnosis, I don't think it's worth it. If you're going to do a pregnancy diagnosis, then you're going to make, changes from a management point of view when you do that. I think that's that's important. So obviously utilizing pregnancy diagnosis to evaluate bull fertility, evaluate your success to your synchronization program, evaluate whatever it might be that would lead to some management decision, increasing plain and nutrition, whatever that might be, is critical.
To stay on that topic, you suggest coming back and then preg checking later. So you preg check early and then you want to preg check later.
Yeah, so I think that with, if you do an early pregnancy diagnosis, I think it's important to confirm pregnancy later at some point. So maybe if you have a set breeding season when you pull the bulls, the longer you go and getting into the calving season and then waiting for cows to calve, it gets really dangerous. You have a situation where you might have animals that aren't, are basically been around that whole time waiting for them to calve, and they're not going to end up having a calf. So trying to get them culled out to gain some value from them instead of pushing them forward and getting nothing from them in the way of a return, I think is critical. So, trying to figure out when you do that, quote unquote, opportunistic pregnancy diagnosis, I think is a good option. Trying to work with your veterinarian in your area on trying to set up times on, when you might vaccinate and how do you combine those things together, I think is key.
Can you comment on differences between pregnancy diagnosis methods? Any differences, like we should use one earlier than the other one? Or?
Yeah. So there's 3 different types of pregnancy diagnosis. So you have rectal palpation, where you go in and obviously rectally palpate the uterus, and that the accuracy of that is good from about 40 to 45 days forward. You have ultrasound, which you can do as early as day 28 of gestation, and then you have chemical or blood-based pregnancy testing, which is as good as early as day 28 of gestation. It really all depends on you working with your veterinarian. So if your veterinarian prefers that you do maybe a blood-based pregnancy test early in gestation, then you follow up with an ultrasound or palpation later on, maybe combining fetal sexing with that. That would be one option. Pregnancy diagnosis is just like the protocols. It's not a one-size-fits-all. So it's sort of picking what works best in your herd and what works best with working with your veterinarian. And I think that that's sort of the most critical aspect. Use one of the proven methods. It doesn't really matter which one you use. And the other thing that I would encourage you to do is use a method that you're going to use the data from. So don't just do the pregnancy diagnosis to look at what the pregnancy result is. Make management decisions, whether it's a management decision that you make the following year of not using that sire again, or doing something different. I think is equally as important.
So, Kai, can you comment on any differences in early embryonic loss between natural breeding and AI or embryo transfer?
Yeah. So if you look at, can you hear me okay?
Yes.
Okay, sorry. If you look at natural service, okay, it's really hard to characterize pregnancy loss in a natural service situation. I mean, it's something that we're trying to do, but you have to have, collars on the bulls to be able to time these things out appropriately. So what the data looks like, and I think this makes sense, is the natural service system or situation has lower pregnancy loss than other reproductive technologies. Now, that's not to say that it's drastically lower. I think that there's a lot of situations where we see similar amounts of pregnancy loss in early gestation, but it might be coming in different periods, all right? And so if we see that, let's say a bull is having a larger effect of pregnancy loss at some time point, then it doesn't really matter if you use natural service or AI, you're probably going to exaggerate that loss during those periods because of a bull effect. And so it just depends on that timing that you look at. I can see the questions now, Vitor. I got my mouse to work.
Great. Yeah. The question from Dr. Mike Smith. Why do you think cows that express estrus have higher pregnancy rates compared to non-estrus cows?
I guess I have to make sure that I get this one right, since Dr. Smith was my master's and PhD advisor. So, I think it's kind of in the situation of the cow showing estrus and having higher pregnancy rates. I think, one thing that you kind of think about is a cow showing estrus in a time AI protocol is sort of the cow hitting the optimal situation. She's hit every step along the way and she's showing estrus. And, so if you think about that, that's probably the closest situation to a natural environment where she's showing estrus and being bred on the AM/PM rule or whatever it might be. The other thing that I think is, in the situation of the cow showing estrus, you have a lot of factors that go into preparing the uterus for fertilization, helping sperm oocyte transport, all these other factors that people have reported on as having a positive effect. So I think that when a cow shows estrus, you have more flexibility in bull fertility than when a cow doesn't show estrus, if that makes sense.
There's a question from Dr. Paul Frick. Fricky is interested in looking at the difference between AI and fixed time AI. So is the fixed time AI data and the meta-analysis adjusted for synchrony to the protocol?
Yeah, that's a great question. So what we did is we put the protocol in as a sort of a factor in the analysis, and we don't have ovulation data on all the cows. So we can probably go back and look at that to some degree, but you're probably right there, Paul, that there probably is an effect of some ovulation, that decreased ovulation in those fixed time AI protocols. But yeah, that's something interesting to look at. And we also have some estrus and no estrus data that we can maybe overlay with that to look at that as a factor.
Since now you can see some of those answers, questions, Kai, like if you want to pick some of those to answer.
Yep.
You can do that.
Yep. Yeah. So the question in regards to any thoughts or hypothesis for decreasing pregnancy wastage or pregnancy loss, there's a couple ways to think about this. One is with the estrus, utilizing some type of estrus detection aid when you're breeding your animals. And, I've kind of thought about this a lot. If I'm a beef producer that has 60 head and I set them up for a time AI and I have cows that come in and, some are in estrus, some aren't. One strategy might be to breed the cows that are in estrus to, an AI or a time AI. And then, one, maybe don't breed the other animals or breed them to a sire that has a decreased value. So maybe the straw semen doesn't cost as much, or maybe use sex semen and conventional. I think there's a lot of opportunities there to maybe not decrease the overall amount of pregnancy loss, but financially manage it a little bit better. And I think people have worked in pregnancy loss for a long time, right? And we've been able to decrease it in some ways, but we still are trying to understand what the factors are and how those play a role. And so until that's fully understood, we have to look at ways to mitigate that. And I think that we can't forget that mitigation from a financial point of view is probably just as important as mitigation from a mechanistic or scientific point of view as well. If you're not looking for embryo losses, but just detect pregnancy, then would you preg check after day 40? If you're going to do a single preg check, I would recommend doing it later than that. If you're doing single preg checks, I would say after day 60. If you're just going to do, if you're going to do a multiple preg check, you can do something in the day 40, 45 range, and then do a final pregnancy diagnosis. That would work quite well. I work with a lot of producers who do AI. Some are getting average results 50 to 60%, but some are getting 70 to 80%. Are you suggesting that it's impossible to get extremely high pregnancy rates, or these producers are beating the odds and just getting lucky? So the thing that I would say is that's a great question. That on average, and thinking of the average is not a safe way to think about this sometimes, but on average, the expectations are in that 50 to 55% range. Now, around every average is a bell-shaped curve. So if you think about that, you're going to have herds that perform quite well because they have all those management strategies in place. They have high body condition score, good plans of nutrition, good vaccination strategies, good synchronization protocol compliance, good technicians, use the highest quality semen, etc., versus the other herds that maybe don't reach each one of those. So I'm not trying to say that the pregnancy rates aren't possible to get to the 60, 65%, maybe even 70% range. But on average, as we go into a random herd and start working with that herd, the expectations are that it's going to be somewhere closer to the 50% range. Do you have any insight as to what might be causing these pregnancy losses? Is it mainly nutritional, environmental, stress related? I would tell you there's a lot of studies in each one of those areas that you've listed there that are nutritionally induced pregnancy loss. There's stress-induced pregnancy loss, simply transportation of the cattle. Transporting cattle after day 7 of pregnancy has a detrimental effect on the final pregnancy rate that you're going to look at. So taking those factors into account is something that's important and something that has to be considered. The other thing is I showed you that pregnancy loss in the first 7 or in a 7-day window from 24 to 31. And I've thought about this a lot because a lot of the producers that I work with and even in the herds that we have here at the university, one of the things we tend to do is as we get into the breeding season and we put seeders in maybe for 7 days, it's not like we take those animals in those 7 days and take them to the farthest pasture. And a lot of times that farthest pasture might have the best grass on it. Most of the time we keep them in a trap right next to the working facility that has poor quality forage in it, and sometimes we're feeding them poor quality hay. And George Perry, who's also a member of the task force and will give a webinar here in a couple months, George has done a lot of work looking at this and has shown that in a 7-day window, you can have an effect of nutrition on embryo quality. And so again, small changes can have big effects in regards to these pregnancy loss situations in early fertility as we think about it. Did you compare IVF pregnancy losses with traditional ET? That's a great question. We used only we used only IVF or conventional ET pregnancies in this data set, just because the pregnancy loss from the IVFs is kind of all over the place. So that's something that needs to be considered and something that needs to be looked at. We know it's obviously higher. It's just trying to get access to those data sets that have large numbers on the beef side to look at that. And yes, there's also a question of, are there studies undergoing to look at IVF embryos and pregnancy loss? And yeah, there's a lot being done. And you know, we have some data to show 20-30% pregnancy loss in IVF embryos after a first pregnancy diagnosis. And that's obviously something that's just not acceptable and something that has to be addressed to decrease that and try to understand the recipient versus the donor versus the embryo-based effect. Did you look at days postpartum at insemination and its effect on embryonic loss? So in these studies, we tried to include as much days postpartum period as we could, and it didn't come out as a significant factor. And the reason is because a lot of the herds in these data sets had a wide range in days postpartum in regards to what we were looking at. Obviously, days postpartum is going to have effect in fertility and something that needs to be kept in mind as we're looking at fertility data and trying to understand that. Sorry, I'm just trying to answer as many of these as I can going through here. So if I am giving a very short answer, I apologize. Is total estrus expression at the time of AI program a good indicator of expected AI success? Yes, I personally think so. Now, there's a caveat to that in the fact that if you have a technician or a sire that really bombs out, then you can't expect to overcome those factors with good estrus expression. A lot of times I think in a time AI protocol, just putting on estrus patches or paint or whatever it might be, and looking at the estrus response will at least give you a good indicator of what your potential success might be. If you show up on the day of a time AI and you have 5% of the females in estrus, I think that you have to make a decision on whether you even breed them and how do you manage that. And so that's something that I think is more of an insurance policy than anything. Preg checking after day 45 will not allow me to measure the herd embryonic mortality. Could this be a weak point in my reproductive program? If you really want to know what the true reproductive efficiency is and calculate it on a per pregnancy loss basis, you have to do pregnancy loss earlier than day 45. Now, I think, Dr. Paul Fricke, who's at Wisconsin, who asked a question earlier, Paul has shown a lot of data that if you look at accuracy of pregnancy diagnosis, if you move from day 28 to 32, you increase the accuracy of a lot of pregnancy diagnosis. So I think that if you take that into account and take into account trying to understand the embryonic loss, doing 2 pregnancy diagnoses is going to give you a lot more data as you look at, trying to manage your pregnancy loss of your herd.
Okay, on that same note, when you're doing a single pregnancy diagnosis, is it worth waiting 60 days or 45 days, or when should you do it if you're going to do it once? I'll let you answer that.
Vitor, can you ask that question again?
If you're going to do only one preg check, when are we going to do it?
Yeah. So if I was going to do one preg check, depending on if I took out the bulls or not, if it's a set breeding season, I would probably do it at about day 75, day 70 of gestation, somewhere in there. Any loss that you see after that's going to be most likely disease-based related. Sorry, I lost the ability to use my mouse again, so you're on mute.
All right, sorry. Okay, so you have one of the early questions here. Can you comment on why do you think those virgin heifers had lowest pregnancy loss versus those versus late pregnancy loss?
Yeah, I think so. This is just my hypothesis, all right? So good thing we're virtually, nobody can throw anything at me. I think that in this situation that the uterus has the capacity in these virgin, I mean, as we look at pushing our heifers, right, there's been a big emphasis in Bos taurus for age of puberty. We're seeing a lot of precocious puberty in our taurus animals. In our Bos indicus, we made a big push to decrease age of puberty as well. As that has happened, I think one of the things that we're starting to see, and I'm seeing a big trend of this in Bos indicus animals, is driving late embryonic mortality. I think what's happening is the uterus has the ability to establish a pregnancy, but once it comes time for that pregnancy to firmly attach and to have good maternal fetal communication, there's issues that start to arise. So that's kind of what my hypothesis is there. I don't have a ton of data to prove that right now, but that's kind of what my idea is.
One of those early questions too is, what are the ways we have now to know difference in fertility between sires?
Yeah, that's the golden question, the $1 million question. So I think our ability to predict sire fertility on the beef side is getting better, but we modeled some data out of Brazil a few years ago with Leandro Krupp, who works for Select Sires, and one of the things that is a little bit worrisome about some of that data is that it took about 10,000 inseminations before a bull stabilized his fertility, which meant that you didn't see drastic increases or decreases in his fertility. And so I think that relying on field fertility data to predict pregnancy rates of our beef bulls is going to be a little bit difficult in beef herds. Now, one hope is that we can capture beef on dairy data to utilize to predict beef fertility in our beef bulls. The other opportunity is technology is getting better. We're understanding more about semen quality, individual semen traits, etc., that hopefully can help us gain in that area as well.
Okay, I'm going to do one last question. It's already 8:02, and then we're going to end this session. So, and I guess this is summarize some of what you talked. So, what would you expect for pregnancy loss when handling cattle 30 days post AI, 60 days post AI, and then 90 days post AI? Or post-breeding?
Okay, so you're talking about what would be the effect of the handling on the pregnancy loss, or what would be the sort of just the overall pregnancy loss as you brought those cattle through in a normal situation?
Well, Kai, it looks like the question's about handling, but I think if you could answer both.
Okay. So obviously animal handling and handling animals in a proper way is a big deal. And I think about this all the time. If we take a group of Bos indicus animals that haven't been handled very frequently, and you do a time AI and you stress them, and then you bring them back for a preg check, and then you bring them back for another preg check, you bring them back for another preg check, that's going to have a detrimental effect if those cattle aren't being used to being worked and you're not working them in a proper way. Animals that you work in a proper way, where you have good animal handling techniques, you're not using a hot shot on them, you're not chasing them around, those type of things. I think the effect on pregnancy loss in that situation is rather low. So what I would say is, with the big herds that we work with in South America that we, bring through for the synchronization programs, we do a day 7 blood sample after AI. We do a day 17 sample. We do a day 24 sample, do a day 31, day 60, day 100 preg check. I see no more pregnancy loss in those subsets of animals than I do in the overall herd. And I've paid pretty close attention to that and looked at it. So I think that, again, good handling and good animal management in the corral and in the barn is important. I don't think that's having an effect. Now, if it's not good and the animals aren't used to being worked and you really stress them or have a lot of transportation-based stress, then you're going to have a negative impact.
All right. I will apologize. There's about 8 more questions here, but it's already 8:05. And for the sake of time, we're going to cut things short. I will encourage everyone, though, if you have any questions, not only related to this webinar, but we do have a Ask the Expert page on our beefrepro.org, and you can at any time send us an email with a question, and we will reply within a couple of days. And if we don't know the answer, we're not afraid of sending that question to somebody that we know can answer well. And so I would encourage everyone to please check our website and make sure that you ask those questions there so that we can get those answered. Kai, thank you very much. I appreciate you taking the time to talk to us today. And I want to thank everybody that's been watching. A great turnout, so I appreciate this. And again, this is going to be available hopefully within a few days on our YouTube channel. Just give us some time to do some editing, but we'll be posted there. So thank you very much, everyone. Have a good night, and we'll see you next year on our next webinar. So thank you very much. Happy holidays.
Take care. Thanks, Vitor.